Hi, everyone. This is Andrea Wu from CACF, the Coalition for Asian American Children and Families. Thank you all for joining in this webinar today entitled Protecting Immigrant Children and Families, How New York City Community-Based Service Providers Can Strengthen Policies and Practices. Today's webinar is coordinated by CACF and features a presentation by Rebecca Ulrich, Policy Analyst at the Center for Law and Social Policy, or CLASP, the national anti-poverty nonprofit advancing policy solutions for low-income people. We're also very happy to be presenting today with Carlin Cohen, Chief Policy and Public Affairs Officer at the Chinese American Planning Council, and Farah Salam, Community Health and Wellbeing Coordinator at the Arab American Family Support Center. This webinar will address how community-based organizations can best protect the immigrant children and families you serve. As you are all aware, immigrant communities today are faced with multiple threats to their safety and security, as well as a growing anti-immigrant sentiment, with much originating from our federal government. This includes, but is not limited to, the threats of large-scale ICE raids targeting recently arrived families and individuals with removal orders, threats of cuts to accessing basic health and human services, including threats to existing language access protections, and threats of hurtful changes to the public charge rule, just to name a few. Participants will learn about key federal policies and protocols to be aware of, and steps that organizations can take to implement or strengthen a safe space policy and to safeguard the well-being of children, families, and staff. CACF is the nation's only Pan-Asian policy advocacy organization. We aim to build an Asian Pacific American, or APA, community too powerful to ignore by listening to our community needs, training APA community leaders, uniting our diverse APA community, and fighting for systems change. We are happy to coordinate this webinar to strengthen our capacity to protect and ensure the well-being of APA and all immigrant families we serve. It is important to note that ensuring language accessibility and cultural competence is critical in serving the APA community. Asian American New Yorkers are about 80% immigrant in nature and have the highest rate of linguistic isolation across any racial ethnic group, with over 40% households having no one over the age of 14 speaking English very well. Interpretation as well as translation of documents, signs, and any relevant information that clients may need is imperative. This ensures that information is accurately understood and combats misinformation that unfortunately is an issue many of our communities face today with all the news about various threats to our communities. Also important to consider and account for is that people may struggle with low literacy levels in their home languages. As you will hear today from the Chinese American Planning Council and Arab American Family Support Center, there are many gaps in language access, and community organizations often have to fill those gaps. Many of you share these experiences as community organizations. For others, we hope you will take a moment to review your organization's language access policies and look to see where they might be able to be strengthened. During the presentation today, we will share relevant resources, both national and local. If there are any resources not mentioned that you would like to share with participants, please feel free to send this to us by way of email, and we will try to share as much information as possible with the community. We will be emailing out today's presentation slides, audio, and links to resources after today's webinar. Now we'll get started with some housekeeping. First, during today's webinar, all participants will be placed on mute. Second, you will have the ability to ask questions by way of the chat box on your screen. Please type the questions directly into the chat box. These can be seen by all participants. Although we may not address questions immediately, but we have reserved time for Q&A after the presentation. And finally, if you encounter difficulties hearing the webinar through your computer, please try the dial-in option using a telephone. Now it is my pleasure to turn this over to Rebecca, again with CLASP.
Thanks so much, and I'm really thrilled to join you all for this webinar today. I'm going to kick the session off by giving a really kind of high-level overview, complementing some of the information that Andrea just shared, giving a little bit of, or setting the stage for the immigration policy context, giving some background on who children and immigrant families are, before transitioning to talk in a bit more detail about some key federal policies that we think you all should be aware of and steps that you all can take to further safeguard children and families in your programs. Next slide, please. So children and immigrant families are a large and growing share of our young child population. More than 1/3 of young children in New York State have an immigrant parent, while half of all children do in New York City. The share varies somewhat by borough, ranging from 42% in Staten Island to 59% in Queens. However, both the city and the state have a relatively higher share of their young child population with immigrant parents relative to the national average of 26%. It's important to note that the vast majority of young children with immigrant parents are themselves U.S.-born citizens, and most live with parents who have some form of lawful status or who are naturalized U.S. citizens. A smaller but sizable share have one or more parents who are undocumented. But it's also important to note that immigration status is somewhat fluid. Many undocumented immigrants currently living in the U.S. arrived legally, but overstayed their visas and became undocumented. Conversely, some immigrants came to the U.S. without documentation, but obtained lawful status over time. And many lawfully present immigrants become U.S. citizens through naturalization. Next slide. Children with immigrant parents have also played an important role in the rapidly increasing diversity of our young child population. In New York City, children and immigrant families are particularly diverse. A little more than half are Latinx, 20% are white, a little more than a third are Latinx, 20% are white, 17% are Black, and 22% are Asian American or Pacific Islander. Next slide. So turning to the immigration policy context, there are three key trends that we've been monitoring over the past few years that have significant implications for children and immigrant families. First, the administration has dramatically heightened immigration enforcement at the southwest border and in the interior of the United States by increasing the number of ICE and CBP agents, making every undocumented immigrant a priority for deportation, increasing formal partnerships between local police and federal immigration officials, and ramping up large-scale worksite raids. We are continuing to monitor the recent threat of large-scale raids targeting recently arrived immigrants with removal orders in 10 cities, including New York. While we have seen enforcement operations in some of these cities and other locations, such as South Florida and Tennessee, they have been scattered and smaller in scale. It's hard to tell if large-scale raids will happen at some point or if there will continue to be more isolated actions throughout the country. But the threat has raised significant alarm among immigrant communities, advocates, and providers. We have also been working with our partners to share resources for families, providers, and communities to prepare for immigration enforcement actions, whether on a small or large scale, and to speak out against such actions. I'll share a link to our blog on preparing for enforcement actions and our resource page in the follow-up materials after the webinar. The administration has also attempted to remove protections for immigrants previously granted some sort of discretion, such as efforts to terminate the deferred action for childhood arrivals and temporary protected status for certain countries. DACA and TPS holders, many of whom have lived in the U.S. for decades, are established members of their communities and parents of U.S. citizen children, continue to live in limbo while their fates play out in the courts. And finally, the administration has taken various actions to undercut immigrants' access to health care and public benefits. We'll talk about the proposed charge rule in more detail later in the presentation. Collectively, these policy changes have made many more children vulnerable to being separated from a parent due to immigration enforcement. The intense fear triggered by the possibility of immigration enforcement also drives how families go about their day-to-day lives, making them afraid to continue accessing programs that are really vital to their health and well-being. The administration is expressly targeting low-income immigrant communities of color in all of these policies, and it is using fear as a tactic to push people out of their communities and into the shadows. Next slide. Now, as you all know, families really trust and rely on the community organizations that care for their children and support them in times of need. And given the incredible amounts of fear that families are experiencing and the threats that I've outlined on the previous slide, and it seems like a new threat is emerging every week, it's more important than ever that organizations like yours are informed and prepared. Next slide. So we recommend that early childhood programs and other child-serving organizations develop a plan to safeguard your program against immigration enforcement and ensure that the safety and privacy of children, parents, and staff is protected. So-called safe space policies are rooted in basic security and privacy protocols that you likely already have in place. And importantly, they are not political in nature. Safe space policies reinforce basic constitutional principles and existing federal agency guidance related to immigration enforcement in certain sensitive locations. They are also directly in line with all of our missions to support the health and development of all children and families. Our guide is available on our website. I'll spend some time talking through it today, but I encourage you to read the full report, which includes more details and a template safe space policy. Please note that the guide is geared towards center-based child care and early education programs, but the basic tenets can apply to other child-serving organizations as well. I'll do my best to note when particular pieces of information about certain types of apply only to certain types of organizations throughout the presentation. If you have specific questions about your organization or program, please ask during the Q&A or reach out to me after the webinar. Next slide. So before we jump into some background on federal policies, I want to mention a few local policies in New York City that you should be aware of and share with the families that you serve. These policies also sort of provide a good context or foundation for implementing safe space policies in your programs. In 2017, the New York City Council passed sanctuary legislation prohibiting city employees from spending any time on duty enforcing federal immigration laws. This guidance previously only applied to city jails and NYPD, but the legislation expanded to include all city employees. Executive Order 41 encourages immigrants, including undocumented immigrants, to seek the city's services, benefits, and programs that they are eligible for. The order also requires city employees to protect the confidentiality of a person's immigration status and other personal information. So if you go to a city agency to apply for certain services or benefits, city employees can't ask you about your immigration status unless it is required by law or necessary to determine whether you are eligible to receive those services or benefits. And they cannot report this information to anyone, except in limited circumstances such as when required by law. And finally, also in 2017, New York City Public Schools issued guidance for how K-12 public schools should respond to requests from federal immigration officials. Now, because the early childhood system is so complex with various settings, funding streams, and program standards, issuing clear guidance and model policies is a little less straightforward than it is for K-12 schools. The DOE guidance may or may not apply to your program, but even if it doesn't, it can serve as a useful tool as you're thinking about developing a safe space policy. And if guidance from DOE would be helpful to you, I certainly encourage you to get in touch with folks at the agency to let them know that. Next slide, please. So now let's talk about the existing federal laws and policies that sort of undergird safe space policies. First, the Department of Homeland Security has long-standing policies restricting immigration enforcement in certain locations, including schools, healthcare facilities, places of worship, religious and civil ceremonies, and public demonstrations. Known and licensed child care programs, preschools, pre-kindergartens, Head Starts, and other early childhood programs fall under the definition of schools for the purposes of this policy. So do after-school programs, other educational events and activities, and school bus stops that are marked and known to the officer during times when children are present at the stop. The sensitive locations policy states that, except in limited circumstances, immigration agents generally should not conduct apprehensions, arrests, interviews, searches, or surveillance for the purposes of immigration enforcement at these locations without prior approval from a supervisor. This policy is rooted in the belief that everyone, regardless of their immigration status, should be able to carry out basic activities and access services that are essential to their health and safety and that of their families without fear of enforcement. Communications from leadership at ICE and CBP suggest that agents are still expected to follow the sensitive locations policy. However, reports of enforcement actions taking place near churches, hospitals, and schools suggest that the policy is not being consistently enforced, or at best is being interpreted very narrowly. In either case, the spirit of the policy is certainly being violated. Next slide, please. We often get questions about the term known and licensed early childhood programs. Unfortunately, ICE and CBP have not provided a concrete definition of what this means. We believe that known is less about whether a program is registered or regulated in some way, and more about whether an agent would know that the facility is a child care or preschool program by looking at it. So a license-exempt preschool run by a church, for example, would definitely fall under the policy. However, we can't say for certain that any home-based program, licensed, regulated, or otherwise, would be included. Next slide. So I want to go ahead and preface this slide by saying that I'm not a lawyer, and the information that I'm sharing here doesn't constitute legal advice. If you have additional questions on this issue, I encourage you to contact an immigrant rights organization or legal service provider near you. So with that disclaimer out of the way, I just want to touch briefly on another layer of constitutional protections that generally apply to early childhood programs and many other child-serving organizations. Case law has established that the Fourth Amendment, which protects individuals from unreasonable searches and seizures and says warrants can't be issued without probable cause, also prevents law enforcement officials from entering places for enforcement purposes where a person has a reasonable expectation of privacy, unless they have a judicial warrant. These protections are the same ones that prevent ICE agents from being able to enter someone's home without a warrant. In general, center or school-based child care and early education programs are secure facilities where access is restricted to authorized staff, parents, and children. Visitors typically have to be buzzed in or pass through a front desk or administrative office before being granted entry. This means that these protections apply to much, if not all, of your program property. That said, every early childhood program's physical space is unique. For example, a child care program might be co-located in a community center, where certain areas are open to the public. Other social service providers or healthcare providers often have lobbies or waiting areas that are accessible to anyone, not just people employed by, enrolled in, or being served by your program. Fourth Amendment protections do not extend to areas within or outside your facility that are open to the public. Additionally, immigration officials may look at anything that is in plain view in a public area. So agents don't need a warrant to inspect or use any information that they can see, like a sign-in sheet on the receptionist's desk, or hear, like conversations between staff members, without assistance while they are in public spaces. Next slide. With these protections in mind, you can start developing your safe space policy by considering the basic security and privacy protocols you already have in place. So revisit some policies related to which staff members are authorized to speak with an agent of authority, storing and releasing private information about parents, children, and staff, communicating urgent information to staff and parents, how authorized staff and parents are able to access the facility, expectations for visitors, and emergency contacts. Ensure that these and other related policies comply with relevant local, state, and federal laws, and consider whether additional policy changes are needed to further safeguard your location and family's personal information. Returning back to that issue of public versus private space that we discussed on the previous slide, that's one area where you may consider improving your existing privacy and security protocols. Think about the property that belongs specifically to your program and how you might be able to clearly designate that property as being for authorized staff, parents, and visitors only. If there is public space in or around your facility, for example, a lobby or waiting area, an outdoor play area, or a parking lot, make sure that there is no personally identifiable information in plain view from those areas. If your basic security protocols are thorough and consistently implemented and enforced, you will be less likely to inadvertently release information to immigration agents or to allow an unauthorized visitor on the premises. Your safe space policy builds on these protocols, giving specific consideration to what would happen if an immigration agent requested access to your facility or information about a parent, child, or staff member. Let's walk through a few key steps. Next slide. So first, your policy should lay out staff roles and responsibilities should immigration enforcement occur at your program. We recommend identifying 1 to 2 designated staff members who are responsible for speaking with the immigration agent. Determine who is responsible for alerting other on-site staff of agents' presence. And consider whether there are any staff off-site, such as an executive director, board member, or lawyer, or community partners such as an immigrant rights organization that should be notified of the agent's visit and who is responsible for contacting them. You'll also want to provide an overview of how staff are expected to interact with immigration agents. If possible, try to speak with the agent outside of the facility and don't buzz them in if you can avoid it. If they're in a public area inside your property, don't let them into any space that's considered private or restricted without checking their documentation. Let the agent know that your program has a procedure you're required to follow for the safety of children, staff, and parents. Oh, I'm sorry. Next slide, please. The designated employee should ask the agent for their credentials, written approval from their supervisor permitting access to the facility, the reason for their visit, and a warrant signed by a federal or state judge to enter the facility for this purpose. Make sure you make a copy of these documents for your records. It's okay to ask the agent to wait while you verify and make copies of these documents. Make sure someone remains with the agent at all times. If agents do not have the proper credentials and a warrant to enter the building, you can politely ask him or her to leave. It's a good idea to have a few scripted sentences written down and practiced in advance, because in the moment it might be scary and difficult. If you're a child care and early education program, I recommend reminding the officer that you're a secure, private facility and protected by the sensitive locations policy. You can tell them that their presence at your facility is disruptive to the normal operations of your program and request that they leave immediately. If agents do provide proper credentials and have permission to enter the building and a signed judicial warrant, or if they cite exigent circumstances, the employee should allow entrance and accompany the agents while they're present on the program property and document all events that follow. In any event, staff should remain calm. Staff should never physically interfere with an agent or take any actions that could threaten their safety under any circumstances. Next slide. Looks like we went backwards. There we go. Your policy should also lay out expectations for staff who are working directly with children. Early childhood programs should try to minimize disruptions to children's routines as much as possible, but prioritize keeping children away and out of sight of any agents. Think about what staff should do if children are on the playground, taking a restroom break, or otherwise out of the classroom while agents are present. Next slide. And finally, early childhood programs should have a plan to notify parents that an agent is present on site and steps that you're taking to protect children's safety and their private information. You should also alert parents when the agent has left the premises. Next slide. So a few additional things to consider, including in your policy. You might want to indicate how you'll make the policy available to parents and staff, how staff will be trained on the policy, and how often it will be revised and updated. You might also consider including resources for staff members and parents, like an overview of the sensitive locations policy, know your rights information, and family emergency planning. Finally, it's important to keep in mind that agents are more likely to be near your program than they are to come and knock on your door. Your safe space policy can also include procedures to follow if immigration agents are near your center or if you become aware of a home or worksite raid taking place in the surrounding community. If staff become aware that ICE or CBP agents are in the neighborhood, you could take precautions. Bring children inside if the playground is visible from the street. Consider alerting parents and revising drop-off or pickup procedures if necessary, and contact an immigrant rights organization in your community for support. Next slide. So again, I encourage you to check out our guide on our website. We're also available to provide technical assistance if you're interested in developing a safe space policy in your program. Just reach out to me over email and I'll be happy to work with you. So now I'll turn it over to Carlin to talk about CPC's experience implementing a safe space policy.
Hello, everyone. Sorry, I did the thing where I was accidentally on mute. I hope everyone can hear me okay now, though. Let me know if you can't. So Rebecca did an amazing job of covering what goes into a safe space policy, and what I'm going to do is talk a little bit more about what it looks like to implement a safe space policy at a community-based organization. So just as a little bit of background, CPC is the nation's largest Asian American social services agency. We were founded in Manhattan, Chinatown in 1965. And since then, we have 33 different program sites across Manhattan, Brooklyn, and Queens, including 6 early childhood centers. And so we have been in the practice of implementing safe space policies across our different program sites. I'm going to share a little bit about some of the experiences and challenges that we faced in that, and then I'm happy to answer any questions that you might have that would help you in creating your own safe space policy. So Rebecca gave a really excellent overview of what the different components of a safe space policy were like, and we actually learned a lot from CLASP as we went about implementing our own safe space policy. There are a few things that we found were really critical in successfully implementing a safe space policy. The first one is training with the staff. And we've obviously already talked a bit about what the roles and responsibilities look like, but doing extensive training with staff is key on this. With CPC, we had an organization of 700 staff. So in order to get all of them trained, but also to create expertise centralized in each of our early childhood centers, as well as our additional program sites, we used a train-the-trainer model. What this meant is that our program supervisors went through intensive training. We started with explaining why safe space policies mattered and engaging around either different situations that could occur or reasons that safe space policies are so critical to implement, just so that everybody was really grounded in the importance of adhering to these safe space best practices and procedures. And then we provided a training model that those supervisors could then use with their own staff. This again allowed each of our programs to have a lead person for the safe space policies, which would make sure that they had particular expertise, had that role designated as one of the people that would be responsible for implementing the safe space policies. And that they were able to respond to the unique needs of their own particular program and site in order to successfully implement a safe space policy there. So the next thing that we did there was then having all of the supervisors that have been trained go through the same training or a similar training with their own staff, again, walking through why it was important, the different best practices, policies, and procedures that Rebecca covered, and then really actually using a lot of scenario planning and role playing in order to make sure that all staff felt prepared. So once staff knew what their roles were, we actually walked through a number of scenarios that were already described to you on this webinar so that staff could practice what would it be like in a scenario that a CBP officer walks in. Who would they talk to first? How would we alert the person whose role it was to talk to them? How would we ensure that there were no documents out in order to be viewed and make sure that everything was behind sight or behind hearing lines. So these were some of the different things. In doing that scenario planning and role playing, staff became more comfortable with the way that these could possibly look, the different scenarios could possibly look. And it allowed staff to ask questions, think through what they would do in a variety of different scenarios, and then plan to be flexible as well. Additionally, we developed different communication channels which allow for sharing of information in multiple directions. So it would allow us to share updates to any safe-space policies, any information that we might know or learn about any potential threats or incidents that might be occurring down to program supervisors. There was also a communication chain that would go the other direction so that if any incidents were to occur in the different centers, if any concerns or questions came up, it could be communicated back in order that we could address it. And then lastly, and quite importantly, communications out to our community members. So one of the key components we found that in order to make a safe space policy successful was really educating our families and community members that we were working with on why we were creating a safe space, how we were creating a safe space, and what it meant for them. And that included everything from who was allowed to enter and exit the building or the different program sites to distributing Know Your Rights information and everywhere in between. And by making sure that the families that we worked with and the community members that we worked with had an understanding of what we were trying to achieve through creating a safe space, it made it so that we didn't have as many issues with concerns about who was allowed access to the space. And it also gave us an opportunity to distribute additional Know Your Rights information to community members. And then lastly, the thing that really cuts through all of this is language access when working with immigrant families. For CPC, the community members that we work with speak over 25 languages, so we were able to determine the most common ones for each particular site and ensure that materials were translated for training, both the staff as well as communicating to community members. This also allowed us to ensure that we were distributing Know Your Rights information and then sharing out resources. So if we were to share out a legal resource, we wanted to make sure that we were referring someone in a language that they would be able to connect with somebody that they spoke in. And so ensuring that language access cut across all of the channels of communication was really critical in establishing this safe space. I will pause here, but I'm happy to answer any questions that you might have about the particulars of this as we continue.
If there are no questions right now, we can keep moving through the presentation and circle back at the end. Please make sure you're submitting any questions in the chat box. All right, so let's move on to talk about public charge. As many of you know, the administration proposed a change to public charge regulations back in October of 2018. CLASP is the proud co-convener of the Protecting Immigrant Families, or PIP campaign, in partnership with the National Immigration Law Center and more than 300 active member organizations around the country. So I'm going to provide a quick overview of public charge, how the administration proposed to change the regulation, and how we're preparing for a final rule before I turn it over again to Carlin and Farah to talk a little bit about what they're doing in New York City to prepare communities there. Next slide. So public charge is a long-standing provision in immigration law designed to identify people who may become primarily dependent on the government for support. If an immigrant is deemed likely to become a public charge, they can be denied admission to the United States or be denied lawful permanent residency, also known as a green card. Public charge provisions are not relevant when immigrants are applying for citizenship. They also do not apply when certain categories of immigrants, including refugees, asylees, and other vulnerable populations. Public charge determinations are made based on what is known as the totality of circumstances test. This means that immigration officials have to consider all relevant personal, familial, financial, employment, and educational factors. One of the things that officials consider is whether an immigrant has ever received one or more public benefits. Under current law, the only public benefits that are considered in public charge determinations are cash assistance like TANF and SSI, or long-term institutional care at the government's expense. Next slide. So again, in October of 2018, the administration published its proposed regulation to dramatically expand the scope of public charge provisions in immigration law. The proposed regulation is over 400 pages long, and I'm just going to walk through it really quickly. It can be divided up into three sort of main categories that make it much different from current policy. So first, the proposal dramatically expands the definition of who is considered a public charge from an immigrant who is likely to become primarily dependent on the government for subsistence to an immigrant who uses one or more public benefits. Second, the proposal adds new factors to the totality of circumstances test. The net effect of these changes is to create lots of ways for people to fail the public charge test, like being low income, not speaking English well, or having a medical condition. There's only one sure way to pass, and that's to have a high income. And finally, the most commonly discussed change, the proposal would add new benefit programs to the list that can be considered when making a public charge determination. So in addition to cash assistance and Medicaid-funded long-term care under current policy, it would include SNAP, Medicaid, Section 8 and public housing, and low-income subsidies under Medicare. Next slide. So clearly, the proposed rule is a dramatic departure from current and long-standing policy. The implications of the rule are far-reaching. Some green card applicants would be directly impacted by the rule because they are too young or too old, don't speak English well, or have incomes below 125% of the federal poverty guidelines and can't pass the totality of circumstances test. Other people would not be directly impacted because they are a naturalized citizen or are exempt as a refugee, for example, but they may disenroll themselves or their U.S. citizen children from Medicaid or SNAP out of fear. States and localities are concerned about what the rule will do to their residents and their economy. New York City estimated that if 20% of non-citizen immigrants forego SNAP, cash assistance, or SSI, the child poverty rate would increase by 9.1 percentage points in the city. Withdrawal from benefits would also lead to a larger loss for the economy of approximately $420 million annually, and that's just in New York City. Healthcare providers are also already seeing more no-shows and patients who are going without care or dropping Medicaid. In many cases, fears have extended to other programs that aren't included in the rule, like WIC and Head Start as well. And finally, at the end of the day, the rule affects everyone, not just immigrant communities. We all do better when our neighbors, friends, classmates, and coworkers are healthy, fed, and safe. Next slide. So let's talk timeline quickly before moving on to how we are preparing for a final rule. The whole process has been playing out for over a year and a half now. The administration began implementing changes to the Foreign Affairs Manual back in January of last year, which had implications for immigrants who are applying for visas or green cards from abroad. In October of 2018, the proposed rule was published, which affects immigrants applying for green cards in the United States. Over the 60-day comment period, more than 250,000 people submitted comments, most in opposition to the rule. From there, DHS is expected to review and consider all public comments before issuing a final rule. We know that DHS sent a final rule to the Office of Management and Budget for review, which is the final step before it is published in the Federal Register. That means we can expect it anytime next month or early fall. Once the final rule is published, there will be at least 60 days before it goes into effect, maybe even longer. So we'll have a minimum of 2 months to prepare and educate communities before the changes are effective. And as a reminder, the rule is not retroactive, so benefits that families are using now and up to the effective date will not be considered in future public charge determinations. It's also important to keep in mind that once the final rule is published, the fight continues. Hundreds of thousands of people already took action to fight Trump's attack on immigrant families. Governors, mayors, congressional representatives, and thousands of nonprofit organizations all over the country, plus Americans from all walks of life, came together to fight for a country where we can all thrive. We are showing opposition in news media, engaging policymakers, and rallying communities to fight this abusive policy. Advocates will continue to use every tool at their disposal, including in the courtroom, to stop a final rule from being implemented. Organizations and advocates are already preparing legal challenges, and state governments are also planning to sue if the administration goes further. Next slide, please. But in the meantime, there are a number of different ways that you can take action and prepare your communities. Stay up to date on news, developments, and related threats impacting immigrant families with the PIP campaign. You can find tons of great resources and information on the campaign website at www.protectingimmigrantfamilies.org. You can also sign up to receive emails and updates through the general list or join as an active member if you want to get more involved. You can also take action by documenting the impact of the proposed rule and other anti-immigrant policies on members of your community and your program. Engage with and educate officials in New York City and New York State to make sure that they understand the impact of the rule on your community and advocate for language-accessible resources. And empower the families and communities you serve by sharing information so they can make informed decisions for themselves. And finally, you can activate your personal and professional networks to join you in the fight. Now I'll turn it back over to Carlin to talk about what CPC is doing to educate staff members on public charge.
Great, thank you so much. So public charge is something that CPC took as a very urgent issue, as we saw that it would impact community members cutting across almost all of our programs. So we did a number of things. We were able to, very early on when the notice of proposed rulemaking was published, begin by engaging staff and community members in both community outreach education and then immediate advocacy as well. So we began by coordinating with other organizations that had been working on this, including CLASP and then other New York-based immigration organizations, to make sure that we had all of the information that community members would need to know, and then created multilingual trainings that would allow us to share information with our community members, as well as dispel myths, ask and answer questions, and share more information around timelines. We discovered that these trainings were received best when they were done by staff that community members trusted. So, for example, somebody's teacher in one of the early childhood programs, somebody's adult literacy instructor, rather than one of our policy and advocacy staff that might not have the same connections with the different community members that we worked with. So we again used the train-the-trainer model in order to make sure that those relevant staff had as much information as possible, could train community members on what they needed to know about public charge, and then could refer specific questions to any of our policy staff that might have more in-depth answers about the technicality of it. At the same time, we also partnered with legal groups that could provide one-on-one legal assistance to anyone that needed it. Obviously, because we are still in the proposed rule phase and not the final rule phase, any legal advice would be really just planning ahead rather than anything that was active. But there were a number of community members that were seeking legal support around this issue. So we also worked with our case managers to learn how to actually triage the different issues that community members were bringing for whether or not they needed to be referred to one of our legal partners or not. And this allowed staff to determine whether a potential question was based in either misinformation or fear, or that there was actually a potential for this person to be impacted by the public charge rule, in which case we would then refer them to legal support. But this allowed us to actually work with the limited legal support we have and make sure that they weren't overrun with inquiries by actually training the staff to do that triaging and separating out the issues that were not as relevant. At the same time, we worked to counter misinformation in the local media. We found that non-English media was sharing out a lot of misinformation and rumors about public charge, including that people should de-enroll from their benefits immediately. And so we worked to place op-eds and host media briefings to uplift the messages that nothing had changed until the rule was final, that people should stay in their benefits, that it wouldn't be retroactive, and that we would have time between any final rule and the actual implementation of that rule, in which we would work with community members to prepare for their separate needs. And then lastly, we worked to do advocacy as well. Staff and community members, understandably, once they learned about this rule, were really interested in finding ways that they could fight back. So we hosted, at the beginning, multilingual comment parties and collected comments from staff and community members around this ruling. And we would plan to do advocacy around the final rule if and when it arrives as well. And then, of course, like with the safe space policy, language access cut across all of these pieces. We particularly noticed that a lot of times resources that came from the city or state would only have minimal translation. So, for example, there would be a flyer that would be translated into Chinese, but then would refer back to an English website. And so community-based organizations were really critical in ensuring language access for these. Similarly, we would see that there would be either town halls or information sessions in, for example, Mandarin or Cantonese, but not in some of the dialects like Toshanese, Fujianese, Shanghainese, that were also going to be important for our community members. So we worked to translate materials and do interpretation in people's home languages for all of the languages for community members that were concerned. And that's something that we are already preparing for if and when the final rule comes, to make sure that people can receive information in the language that they're most comfortable with, and then also provide that translation for legal support as well for our community members who will require legal support at any point in the future.
Okay, hi all. So similar to what Carlin said, we're also doing a lot of similar items. You know, educating our staff and doing the triaging, and that's really important when we share this information with our population. So here at Arab American Family Support Center, we provide services and specialize in services and empowering Arab, Middle Eastern, Muslim, and South Asian immigrants, refugees, and families. And what we do now is that we provide information sessions in the languages that our clients speak. So, you know, as we trained our staff who also like CPC, we have language capacities of over 20 languages and 30 different dialects. So by training our staff and helping them understand what public charge is, that helps us in disseminating the information to our clients, because we work with clients all over the 5 boroughs. In addition to that, we also provide documents and resources in Bengali, Urdu, Arabic, Nepali, Tibetan, and we're also working with protecting immigrant families in providing these documents. We see that this is really helpful, and we post this information all over the office so that when our clients come in, they can see what they, you know, the information, and can easily, you know, read it in a language that they're comfortable and knowledgeable in. We also integrate this information into our ESL classes, and our classes focusing on citizenship. So we provide different varying levels of ESL classes, and oftentimes we have students come in and ask questions. So one of the first things we did before even working with our caseworkers was training our ESL staff on what public charge is and helping them understand that a little bit more. We also have an on-site attorney who is in our office once a week, so we were able to ask him questions and have him help us understand the intricacies of public charge a little bit more, so that when ESL students would come and ask the ESL teachers what they can expect, they wouldn't have to wait to ask our lawyer. And only in, very complex or complicated questions would they have to ask the lawyer. We also, with our citizenship classes, because there's a lot of confusion about public charge, we also provide that information to our students who are applying for citizenship. And while it doesn't apply to them, it may help them to understand, because they may have family members who are still, confused or still immigrants, and don't have lawful permanent residence. We're currently working on providing information to faith-based leaders and providing them with resource lists. We recognize that a lot of our MEMSA community members, so a lot of the community members that we work with, don't always come to our office, but they do go to the mosque, they go to church, they go to temple, and providing this information to our faith-based leaders and faith-based community members is really integral in ensuring that we reach out to our clients and to the communities that we serve. Currently, we're scheduling information sessions to make sure that we reach a wider lens and wider reach of Arab, Middle Eastern, Muslim, and South Asian community members. So while we're working on reaching out to all of the different communities that we work with in Brooklyn, Queens, Manhattan, Staten Island, and the Bronx, we do face a lot of challenges. There are communities that we aren't reaching out to in need of this information because they might be undocumented, they might be immigrants, or they just don't know we exist, and we don't know where their neighborhoods are, because we see that a lot of different MEMSA community members are coming and moving, and there's always changes happening in terms of the changing demographics of neighborhoods in the 5 boroughs. And so there are definitely a lot of people that we're missing. For example, even though we have offices in all 5 boroughs and staff members in all 5 boroughs, it's really hard to reach out to all of the neighborhoods that are there. This is why we focus a lot on the outreach and working with other communities besides our organization. On top of that, because the communities here are large and tend to, because they're large and tend to, we don't have the staff to always go into the communities and work with different communities on an individual basis. A lot of the information about public charge is misconstrued by community members because of what the media is reporting, both the American media and the media outlets from, the Arab media outlet, the Bengali media outlet, and other cultural media outlets. And that's one of the issues that we're seeing right now. And then another thing that we see is that while we do print out and provide a lot of resources on paper in different languages, there is a little bit of, there are some barriers with literacy, because a lot of the clients that we work with may not even be literate in their own language that they speak. So a lot of the clients that we see, especially those who come to our ESL classes, might not be literate even in Arabic or Bengali. So it's a little bit harder to disseminate the information and know your on one-pagers and a know your rights sheet. So, those are a few of the things that we're doing, and those are a few of the things that we're seeing that is a little bit challenging for us, but overall we're seeing that our outreach is working really well, and in working with faith-based leaders, we're able to reach a lot more Arab, Middle Eastern, Muslim, and South Asian communities and educating them about public charge.
Great. Anything else to add about communicating with staff members or community members about public charge?
So one of the things that we saw, or we really benefited from, is having a lawyer on site, an immigration lawyer on site. So, and we realized that that's not something that a lot of community-based organizations have access to, but having him on site has helped us in understanding the changes a lot more, and he has been able to explain to our staff and answer their questions. But, you know, for those community-based organizations that don't have that access, we also encourage using a lot of the free legal resources that that are available to you. Or, you know, if you have any questions, you can always reach out to us, and we can provide the information to you in a timely manner. And yeah, we always expect to have questions from staff. And the thing is, you know, since we're not all legal, we're not immigration officials, we're not lawyers or anything like that, we don't, and because the rule change has not happened, there's nothing is set in stone. So that's one thing that we continue to reiterate, so that both our staff and our clients understand that these are the potential changes. This is what could happen, but again, everything is dependent on what after the comment period, or not the comment period, but after the comments are gone through and any rule changes happen, or if the rule is even published. So.
Thank you. And I'm glad that you brought up the issue of the benefit of having a lawyer on site. And actually, Shiva, can you go to the next slide, please? So Farah and Carlin and the folks at CACF pulled together this list of legal and casework resources that all of you can be aware of in connecting with folks who are, you know, kind of deep in the weeds on some of these policy issues, as well as some directories and hotlines that might be able to connect you to rapid response resources or legal service providers. Farah and Carlin, do you want to say anything else about these organizations?
Yeah, so the New York Immigration Coalition is really, like, their website is really useful. I've used that website a lot, and actually they provide a train the trainer that I went to and benefited from. So if you are able to, or if any of the participants in this webinar are able to, I would highly suggest reaching out to the New York Immigration Coalition. They provide really great train the trainers, and also the link that we provided has a list of legal service providers that you or your clients can use to ask any questions and get a lot of support and guidance from. We also provided, the Arab American Family Support Center also provided our website, because we have, along with our immigration attorney, we also have immigration staff who, although they cannot, you know, provide some of the resources and support that the immigration attorney can, our legal staff can definitely answer questions and provide clients with guidance. So you can always look at our website and contact us or call us at this number. And we found that the Catholic Charities New Americans hotline is really, really useful for any clients or anyone who's seeking legal services but might not be in Brooklyn, because unfortunately for us in the Arab American Family Support Center, we only provide legal services at our Brooklyn office and cannot provide it at any of our other sites. I don't know if, Carlin, you want to talk about the Chinese American Planning Council's resources?
Absolutely. So just a few things to add to that. I included the Chinese American Planning Council's information, and you can feel free to reach out to me at any point. I'm happy to share out any of the resources or materials that we have used to do trainings with our staff. I'm also happy to chat with you about the programs we put together and what worked well, what didn't work well for us. I will second Farah that the New York Immigration Coalition's Train the Trainer program is excellent. And then the last thing I would add is that as an organization that does not have a immigration attorney, an immigrant justice court, do mobile legal clinics during certain days at our different program sites, so that we've relied very heavily on both the Catholic Charities hotline as well as the Action NYC hotline. And in our conversations with the City of New York and the Mayor's Office of Immigrant Affairs, as the public charge final rule potentially drops, their plan is to put in additional resources and extend the hours of the Action NYC hotline to do more round-the-clock support.
Great. Well, I think that wraps up the presentation, and we have plenty of time for questions. Shiva, if you want to move to the next slide, please. As a reminder, you can share questions in the chat box. I actually want to start with a question for you, Carlin, about your safe space policy. When you all were in the process of training staff on the policy or sharing the policy with your family members, did you get any feedback from staff or parents that, you know, caused you to go back and revise your policy, or what was that process like?
Absolutely. That's a great question. So our policy was, we put that together based off of the template that CLASP provided, and that was really good for us to use for our early childhood centers, as well as our other program sites, whether it be after-school senior centers, whatever it might be. We had to do some adapting, obviously, depending on the type of site that it was. The big piece of feedback that we got from staff around our policies was less about the and that a lot of staff just felt scared about the idea of actually carrying out these safe space policies in the scenario that somebody from CPC or ICE came to their work site. And it's important to keep in mind that our staff are our community members that we serve. They come from our communities, and so a lot of these issues impact staff as well as communities. And so we really had to think through how to make sure that staff felt safe and comfortable implementing these safe space policies. That meant a few things for us, thinking through first, who were the right people to appoint to be the ones that would actually interact with anybody coming to our centers. And then second, really going through, as I mentioned earlier, doing the role playing and making sure that people felt comfortable practicing what somebody would say, what an actual scenario would play out like in terms of timing and response, and really just getting staff to a place where they felt like they were prepared to respond to a variety of scenarios. With family members, the big concern that we heard was mostly around how we were ensuring that data was being protected. That has been a consistent concern that we've gotten, and particularly for limited English proficient families that might not necessarily have access to information about how data is protected in their language. And so really thinking through how to thoroughly explain the protections that we had in place for data in a variety of languages was critical for us.
Great. Thanks so much. So Farah, I'm wondering if you can share with us what some next steps are from the Arab American Family Services in terms of preparing communities for public charge. How are you all thinking about some of the enforcement actions that have been threatened? And are there any other kind of things that you all are working on that you want to share with folks on the webinar?
So, like I said, you know, in terms of making sure that the information gets out to our communities, we want to continue integrating this information into our classes so that our clients better understand it. We're also thinking about working with our youth because we've noticed that, you know, oftentimes within our communities, the youth are the most, you know, they're the ones who help their parents, they're the ones who often are translating, so educating them will help in educating the families. So that's what we're planning in the future. Again, we're still planning on working extensively with our faith-based community leaders as well as community centers. And, you know, should the rule be published, we would definitely, you know, retrain all of our staff, and also because we have a lot of staff who, you know, work with families, go to their homes and work extensively and intimately with these families, we would definitely train them to field any questions. If there are any families that are in danger or, you know, would be subject to public charge, we would definitely train our staff in helping them understand like what guidance to provide and what type of legal resources that they can use. You know, if they're in Brooklyn, of course, they can always come to our office, but if they're in another borough, you know, referring them to other legal resources there so that any families can, you know, go to an immigration organization or immigration advocacy organization there to get services and also, you know, understand what benefits they're entitled to. Because a lot of the confusion does fall on, you know, what benefits would they be entitled to, especially since, you know, we've seen in a lot of communities and also, you know, with the Urban Institute showing that a lot of families have been dropping out of their public benefits due to the announcement of the public charge rule changes. So that's what a lot of our staff would be focusing on.
Great, thank you. Well, if there are no other questions, we can go ahead and wrap up with just some final thoughts. Farah or Carlin, do you want to kick us off? Any final thoughts you want to share?
Sure, I can go ahead. I think that one of the things that we really learned was that creating these safe space policies would actually allow us to be flexible for a variety of different immigration-related threats. Once we had built out the train-the-trainer model and the communications channels, we were actually able to adapt them for any variety of scenarios, whether it be public charge, whether it be the rumored ICE raids, or even other issues that were not necessarily connected directly to immigration, but around know your rights in general. And we also found that by doing this work with our staff and with our community members, it not only allowed everybody to be prepared for any potential scenarios that might happen, but to think through other ways to make plans to protect themselves and their families, whether at home, in the workplace, or in other programs that they might go to. And it created a sense of people feeling more confident about what their rights were around a variety of issues. So while it was definitely a lift at the beginning, there are a ton of resources available, everything from New York Immigration Coalition to CLASP to CACF and of course community partners like CPC or the Arab American Family Support Center. At this point, I think that there's a lot that can be learned from, so you don't have to reinvent the wheel. And we found that it was really worthwhile to make sure that we had these multilingual programs and procedures in place.
And I can echo a lot of Carlin's thoughts. One of the things that I do want to say is, like, you know, we started our training the trainer and educating our staff fairly recently, and we're learning how to implement a safe space policy. So, you know, if you haven't started yet, it's definitely not difficult to do so. And once you get the ball rolling, it's actually a lot easier to, you know, work with the staff. And once you, again, as Colin said, establish the foundation for it, it can go a long way, especially when it comes to other immigration-related concerns. And again, you know, as Carmen said, you don't have to reinvent the wheel. You can definitely contact me or her, because, you know, we've been doing this for some time, and we would love to share all of the information that we've learned and all of the trials and errors that we have, so that it's an easier transition for your organization to have the same services or similar services for your staff and clients.
And I'll just say that I'm, you know, thrilled to be with you all to talk about these issues. I'm really always so excited to hear about the work that's happening in community organizations to really, you know, put some of the policies and the tools that we're developing, you know, at the national level into practice. And I'm really hopeful that they're useful to many of you. I want to reiterate that CLASP is certainly here to help. We're always here as a resource, even if it's just kind of a basic question, or if you're looking for more kind of nuanced technical assistance, we're happy to provide that as well. Can we go to the next slide? There's all of our contact information. And then I'll just make sure, Andrea, is there anything else that you want to add from CICF before we wrap things up?
We just wanted to thank everyone for taking the time to attend this really important webinar, and especially to thank Rebecca, Carlin, and Farah for providing such important information and learnings for our community. As we mentioned, after this webinar, we will be sharing the slides and audio, so, and especially to those who were not able to attend today. So mostly we just wanted to thank those who were able to attend, and we hope that we can more largely just share it back to our community and continue to help folks learn more about how to create safe space policies and protect our immigrant children and families. Thank you, everyone.